Time saving in the NHS and certainly with HIE is beneficial now. We are pushed for nurses nationally, so anything that saves time improves quality of care. So the fact that you've got all of that information in one place removes the nurse from taking herself away from the patient, making the phone calls, trying to find out the information, and that the benefit of that is better quality care for our patients and time saving for nurses, which they need.
We've done some analysis of the cost savings and we've saved some quite significant money in terms of primary care. We're currently doing some cost analysis within the hospital, and in the future we'll do some cost analysis of the community trust as well.
So here at Lewisham and Greenwich we've done a number of studies to see how HIE improves the time taken to gather medicines history information. On average we found that it saves us about 11 minutes per patient to try and gather their medicines history, and that's about a 42% reduction in time taken to gather medicines history information. For us that's been a huge saving in our staff time, and it's also improved the accuracy of the information that we're gathering and the accuracy of the records that we maintain.
Repeating x-rays is a huge expense. It's inconvenient and worrying for the patient, and also unnecessary increases radiation. So I do feel very strongly that it's helpful to look on HIE for recent x-ray results, but the same would be true of other investigations such as ultrasounds or blood tests. Avoiding duplication is a better patient journey and a better use of resource.
In terms of the back office for the hospice, in terms of running a voluntary sector charity, it means that we potentially save time on administration costs and some of the faxing and other methods historically used to access information. And that is both saving in terms of costs, and obviously then means that we can put that money back into care.
So if I'm able to save time during the day when I'm doing my repeat medication requests, when I'm looking through my letters, then that then allows me to go home on time, which is really important for my mental health, because if I'm not picking up my daughter, and I think that's a really important thing, especially in primary care, that we need to be protecting ourselves a lot of the time. So I think that's where a lot of the efficiencies go to actually. We can build it into meaning that we can see more patients, but ultimately if we can protect ourselves, we're around for a lot longer to be able to see more patients in the long run.
As you can see, there's many multiple layers of savings, of benefits, of what it's meant to both executive level but also clinical level.